Remember, dementia can also be caused by our cardiovascular system. So if we're walking and we're making our cardiovascular system better and stronger, then that actually helps reduce the risk of dementia from the standpoint that it reduces the causes of the circulatory system causing dementia, because what flows to our brain and what brings blood to and from our brain is our circulatory system. So if we address our circulatory health, our heart health, our blood vessel health, then we can help reduce the risk of dementia and other types of cognitive problems by simply improving blood flow to our brain. And a good way to do that, of course, is make sure that our medications are under control and walking or doing some type of cardiovascular exercise on a regular basis. If you're not able to walk, then going and getting on a bike and just getting your heart rate up for a good long amount of time is going to be very beneficial. Now, if you're able to do 30 minutes, do at least 30 minutes if you can. And of course, if you can do 45 or 60 minutes, that's even better. And so if you're not able to start there, then start with 5 or 10 minutes. Do with what you can do and then build up. It's amazing what can happen when you build up over time. And to me, that's one of the fun things of exercise. It's seeing that progression. It's you have complete control for the most part over your human body by moving it, sculpting it, lifting, stretching, doing whatever you want to do. You have a large amount of control over how good your body is. And that's part of the fun of it. And seeing that progression and saying like, wow, I was doing this before, now I'm doing this. Or I was lifting this much before, now I'm lifting this much. Or I was this size then and I'm this size now. Whatever our goals are, whether we're trying to get bigger or smaller, or whether we're trying to improve how far we can walk or how many times we can stand up and down from a chair or how much weight we can lift, whatever we want to do with our bodies, we have a large amount of control over that because we can shape and sculpt our bodies how we want to. Now, another way to take care of our physical bodies is, of course, balance. And this is a big one. The first thing you can do to improve your balance is to be up and walking on a regular basis. If you use a walker now, go ahead and keep walking with a walker so that you're safe. And just because you're using a walker doesn't mean that that doesn't work on your balance. If you're up and walking on a regular basis with a walker, that's going to improve your balance. Only to a certain point, of course, but it's better than not, because the other option is if you're not up and walking on a regular basis, even if you're using a walker, you can have better balance or worse balance walking with a walker, or it might be the type of walker that you're using. You might be able to walk with a walker with 4 wheels versus a walker with 2 wheels, and one might be better for you than another. Now, if you're not using a walker and you want to get after this and prevent yourself from using a walker, this is a great time to start, basically now. So you want to start now to prevent balance problems. And remember, as we often talk about, our balance system declines very quickly. And even by the time we're in our 30s and 40s, our main balance system, our vestibular system, has declined. And the proof of this is take your children or your grandparent to the amusement park and see how well you do on the rides versus them, and how dizzy you get or how much you want to go on all those spinning rides and all that stuff versus them. It's not just because of age. It's not just because you've gotten older. It's because you haven't done those things since childhood in that way. Now, if you took someone who did do those things on a regular basis, let's say a fighter pilot or something like that, or someone who does spin themselves around on a regular basis, then they would be able to do those things as adults when they're 45 years old. If you don't use it, you lose it. If we stimulate it, then it's going to improve and get better. If we don't stimulate it, then it's going to slowly or quickly decline. So if our balance is declining by the time we're in our 30s and 40s, what happens by the time we get into our 70s, 80s, and 90s with our balance? So the first thing you can do, of course, is walk on a regular basis with or without a walker. Of course, regular exercise and going to group exercises or doing some type of balance training in a fitness setting is a great way to start. If you're worried about actual falling, and that's a valid concern, go to your doctor, go to a physical therapist. If you want a main specialist, go to a vestibular specialist. That can be an occupational therapist or a physical therapist or a chiropractor. There's a number of different rehab professionals that are vestibular specialists, and those are the main specialists in our main central balance system, basically dizziness and vertigo disorders, but they're also very, very, very specialized in balance training because they're specialists of the main central balance system of the human body.